Okay, testing, sound check, testing. Okay, testing, sound check, testing. Okay, everything looks good. Again, I'm from a new place. Want to be sure there is no technical glitches. Good morning. Today is Saturday, January 29, 2022. This is our regular yoga therapy session, and today's topic is yoga therapy, movement as medicine. It's a wonderful topic, and we, the senior people, we need to keep it in mind that the balance and the movement is the key to our health and healing. Our whole body is functioning, moving, and the movement in yoga therapy and Ayurveda is called a Vata energy. We have three kinds of energy in the body. Catabolic energy, which is our psychophysical body type called Vata. Primary energy is the movement. Pitta is the primary metabolic energy, which is the heat or the fire within us, and the kapha is the water and the grounding energy called anabolic energy. So when you see a person dying, the last movement is the last breath. Remember, breath is also a movement. So we call the person expired. After the expired, all the movement stops. The heart stops, brain function stops, all the cellular function stops. That means our Vata energy is leaving us body. After a while, the body becomes cold. That means our Pitta energy, which was fire or the heat, is leaving our body. And finally, if you keep the body for a little longer time, the body will shrink, the body will mummify, which is called kapha, the water, the anabolic energy is leaving our body. So I put a little picture on the Facebook for this class. I put a bicycle and I put a caption: to keep the balance, you have to keep moving. If you put a bicycle stationary at one place, it will fall down. The bicycle moving will keep the balance. And the balance comes from proper inflation of both the tires, front and back. Very important concept. Proper inflation of front tire and the back tire. That means a balance comes in our body with a proper function of the right and left side of the brain. That is the balance. We are all being lateralized. We are right-handed, right-footed. We're always using right hand, right foot. You have to use a non-dominant hand, non-dominant foot. You have to keep both the brain functioning equally, so you will have a balance and you will have a bicycle and you will be moving. In yoga, health is defined as a balance of our body, mind and spirit. So as you see all the time in our practices, we teach tremendous amount of balancing asanas, balancing pranayamas, balancing meditation, all in the balance. You keep moving. Moving keeps you balanced. Movement is not a sign for a certain part of the day or time. I go out to walk, go out to run, I'm moving, that's great. But you have to incorporate the movement in your daily lifestyle. And I'll show it to you how to incorporate the movement. Movement of the joints are the most fundamental movement. You can keep your balance. So I will show it to you how you incorporate the movement of the joints, movements of your balances. Very, very important concept. Let's start with our hand. Most fascinating part of our body. If you look at our brain, half of our brain controls the two hands. 1/4 of the brain controls our head and neck, and 1/4 of our brain controls the rest of the body. It is called a homunculus. That is the short person. I have a picture in my book. I show it to all the time. Hands. Look at the number of joints hands has. You have to keep the hands moving. How do you keep the hands moving? You keep the hands moving by the movement of the baby. We all learn the yoga from the baby. So we call it a mudra. We call it a Balu Mushti Mudra, called baby fist. Baby does not close the hand like this. Baby puts the thumb inside and closes. This is called a baby fist. This is called a Balu Mushti Mudra. Balu means baby, Mushti means fist, and Mudra is a hand gesture. This is also called the Adhi Mudra. So you practice it throughout the whole day, from the morning to the evening, and also during morning yoga practices, we do it with our breath. We breathe out first, take a deep breath in. We do breathe out, we do the yogic fist. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Wrist gets relaxed with the extension. Breathe in, breathe out. Breathe in, breathe out. I do it with my eyes closed. Breathe in, breathe out. Breathe in, breathe out. One most important yogic concept is, which is different from Western medical concept. In yoga, our whole body, mind is integrated. Movement of your hand, movement of your wrist makes a movement for rest of the body. When you're able to relax your muscles of respiration, your breathing becomes deeper, the respiratory rate becomes slower, and has a better movement of the diaphragm, better movement of your lung, and better function of your body. Remember, movement is not that only muscles or skeletal. Your heart is moving, your lung is moving, your intestines are moving. So you have to give the movement. Like we wake up in the morning. First thing I do, I sit down. First thing in the morning, when I get up, I'll sit down in a squatting pose. This is the pose, I'll sit down. Then I get a big glass of water in the room temperature. I will drink. When I drink in a gulp. 1 gulp, 2 gulp. This is the movement. And when you start the gulp, you start the movement of your esophagus, you start the movement of your intestine. When the water comes into your stomach, stomach stretches, it causes a reflex called gastrocolic reflex. When the stomach stretches, the colon contracts. And sitting in this posture, your anal canal, rectosigmoid junction is straight, you get a perfect bowel movement. I have one, it's called your squatty potty. I have a squatty potty next to my commode, and I sit down and a perfect bowel movement. So remember, there is a movement going on inside my body. That is a medicine. Movement is a medicine. First thing when you have a bowel movement, that's a medicine. Carrying that stool in your colon throughout the whole day is the most toxic thing you can do for your body. Then I separate my hand. There's a relaxation of my hands get separated. Look at that. When your hands are, when your hands relax, my finger goes like this. I can hands turn over everywhere. When the hands are tight, finger doesn't go, it's tight. I do the same thing for my toes also. Get my toes separated. Hands like extension of the wrist. I put my one elbow inside, other elbow inside. Bring it close to me. Keep my spine straight. Eyes closed. Breathing out longer than breathing in. From here, a primary movement as a medicine for us, for a practice, is sit, rise, test. Able to get up without a support. And when you're able to get up without a support, your whole movement as a medicine starts. So what happens when you keep your joints moving? Say, for example, I'm here, I always sit in a, say, hopefully you can see, this is my kneeling stool. Many of the time, I would be able to sit down in a kneeling stool. When I sit down in a kneeling stool, I take my one leg and I wrap it around. This is your Garudasana, and I'm sitting down comfortably. I do it when I'm sitting in a chair. I do it when I'm having, say, I'm sitting in a table. Even for my dinner, I will put my leg like this. Sitting your eagle pose or Garudasana. Do the balance, do the same thing, opposite side. So take your foot, go all around it, wrap it around, and bring it back and comfortably sit down. Wonderful, wonderful practice. You incorporate in your lifestyle. I'm doing something on my table, on my desk. My legs wraps around underneath my desk. I'm having dinner on my dinner table. Legs, nobody will know. You don't have to tell to anybody. You are continuing movement of your joints. Sitting, Garudasana. Even when you sit down in a kneeling stool. I mean, I have so many people come to me. What happened? You don't have any support in the back. How do you sit down? This is the way sit down for your movement as a medicine. Why? You don't have any support. Your spine is straight. You are always in a state of motion to keep you in balance. Isn't it a wonderful idea? which we don't understand. So, very important practice which you'll be incorporating in your lifestyle. So, throughout the whole day, whenever I'm getting a time, I'm doing like this, sitting down comfortably in a squatting pose. I'm getting up in a squatting pose. Then I incorporate what is your Bhastrika Pranayama, bellows with sit rise test. Look at this and do it for a daily practice for a short time. It is a wonderful practice. I do it daily. As I said, we are talking about all from our experience, and it's not me, it's all of us. And we taught it, and the people are doing it, and with a wonderful outcome. After daily yoga practice, every other day, Monday, Wednesday, Friday, I go down to the gym, I do a treadmill, I do a little weight training to keep my muscles functioning. Then also remember, when you are moving your joints through the muscles, you have to incorporate your breath. Always have an effortless breathing. And you breathe out first. You breathe in before a muscle starts to work. So if I am doing some biceps curl, I will breathe out first. I will breathe in here. Then I'll breathe out here. Both hands, breathe in, breathe out. Same thing I'll do for the triceps also. When I do the little weight, breathe in, breathe out. But incorporating a Bhastrika Pranayama with a sit-ups is a wonderful movement as medicine. Hands in a prayer pose, take a look at it. Breathe out first, and the active inhalation, active exhalation. Keep my eyes closed and keep on doing as much as I can without any pain, without any effort. I did 20, and as you can say, my breath is still effortless. I'm talking, but I still feel the effect of it. It has the same effect as a cardiovascular workout. So just to show you, this is my electronic monitor. I did a 30 seconds EKG. My heart rate is 121 and normal EKG. So think about maximum heart rate. Maximum heart rate you calculate 220 minus your age. If you're 70, it will be 150, will be maximum heart rate. If you achieve 80% of it, 80% of 150 is 120. If you get a heart rate of 120, you are achieving a maximum cardiovascular effect from a practice. And look at that. With just 20 sit-ups, I got into 80% of my maximum heart rate. It might have been more, because by the time I did all the EKG, it came down. So it could be 85%, could be 90%. So incorporate. Simply put your hands together, eyes closed, gives you a focus on your breath. Continue. Wonderful practice. Keeping your body straight. Jashthyasana, Dandashan, mountain pose. These are all keeps your whole body and joints moving. Simplest way, put your body against the wall. See, I'm showing you everyday practice, daily routine. Your heel is touching the wall, back is touching the wall, head is touching the wall. Hand goes all the way high up. Eyes are closed. Breathing out longer than breathing in. The flexibility of the body is health. Flexibility of spine is the health. Rigidity is death. Ultimate rigidity we call it rigor mortis. And as a physician, I make it fun. I said your life is EKG. EKG, you get a spike. The moment you get a flat line, that is rigid. When you're rigid, you get a flat line. So, you kept your spine straight, then you do the different movement of your spine. You can do a back bend and put your feet together, hands on your feet, and slowly drop your head to the back. You can do against the wall again, Remember, I don't teach. I share the practice I do. I share the practice I do with you. So what happens? We have our database based on the health tracker. I carry the Apple Watch. You can use a Fitbit. You can use any kind of health tracker when you're practicing. Here you put your body slowly to the back, all the way down to your head, and slowly can raise high up. You're talking, you're breathing. That's more important. Back bend of your spine with the effortless breathing. Lateral bending. Tirjak. Asana. We call it the oblique mountain pose. If you raise your hand high up, easily can go on both sides, but you get a lot of instability. Hold on to one arm, put the other arm, put your hand over your head. Fix your body. Breathe out first. Take a deep breath in. Slowly drop your body on one side. If you keep your eyes closed, just keep doing your breathing, breathing out longer than breathing in. Come back to the middle and bring a balance to the opposite side too. Flexibility of the spine. Flexibility of the spine, movement, and movement brings the balance. Concept of a bicycle. Bicycle needs to be moving to keep in balance, and bicycle needs to be properly inflated, both front and back, to be in proper balance. Forward bend, flexibility of the spine, hand touching your feet, Padahastasana or Uttanasana. Hand goes high up, slowly it will come down, and you will see slowly and slowly, hands will come all the way down, and still a little longer and longer, you will feel the relaxation sets in and the head keeps coming down. Head comes down, put a hand on both sides, hand will come towards your knee. You also can put your hand and bring your head close to your knee. Stay here. Normal practice, I'll stay here between 5 to 10 breaths. So keep the spine straight, bend the spine to the back, bend the spine to both sides, bend the spine to the front. I'm still in an effortless ease. I'm comfortable standing like this to bring the balance, as I mentioned on my last class. Going against the grain of your habit is balance. Doing the law of opposite is balance. If you put something, food in your mouth, if it tastes good, spit it out. I'm just kidding. No, this is really, you have to eat all the 6 tastes. Oh, I don't like bitter, I don't like sour, I don't like salt, I don't like sweet. No, you have to like all the 6 tastes. Astringent, bitter, pungent, salty, sour, sweet. Put your feet together. This balance is also your movement. It's amazing, and if you notice it more and more, I don't know if you notice it all the time, I'm right-handed, but most of the time is my left hand is now more active. Is it my left-handed getting more fun? No, I've been using my right hand all my life. I have a neuroplasticity. I brush with my left hand. I use my computer mouse in my left hand. I use my left hand all the time. I'm pointing it to you with the left hand. I open the door with my left hand. I empty my dishwasher with the left hand. I'll pick all the dishes with my left hand, put it there. So this is a normal practice for me. From there, I again we are doing the sit-rise test with the balance. Cross my feet. So crossing feet, I'm sitting down, but cross my feet, I'm getting up. Same way. Cross my feet in the opposite side. I'm sitting down and I'm getting up. Eventually, with more practice, I'll be able to go sit all the way down on the ground with my feet crossed, sitting down like this. But there is enough studies done like now. This action is better than any cardiovascular work you can do. By the time you can get up, without a support, you have a wonderful cardiopulmonary performance. We talk about cardiac stress test. This is no less than cardiac stress test. As I say, by the time you incorporate this practice, you don't need any of those tests you're talking about. But on the other hand, me being a physician, I do go for a cardiac stress test. I go for all the regular checkups just to see the integration of this practice in the Western medicine. That all my functions are still good enough. From here, I get up without a support. Then incorporate the balancing of both the tire of the cycle. balancing poses on each foot. Hand is a wonderful balance control. Your vision is a balance control. So what I do, or what we do in our practice, I put my hand behind as a prayer pose. Paschim Namaskar, prayer pose to the back. In a Paschim Namaskar, now I'm right-handed, right-footed. Say if I can stand on my left foot. "10 seconds, 20 seconds, 40 seconds, close my eyes, see if we can stand on one foot. Same way we can do standing on the right foot. We've seen so many people when they start, they said 4 seconds feels like they're 4 days. 10 seconds, 20 seconds, 40 seconds. Close your eyes. When you're able to stand up, closing your eyes, I do it every single day. Still, it is very difficult for me. Closing your eyes, standing on your one foot. Moving meditation. Moving meditation is called Kati Chakrasana. Separate your feet, hands are in the front. We'll be moving your hands with your breath. Breathe out first, deep breath in. Breathing out, slowly rotate your hand all the way to the back. Same breathing cycle, come back into the middle. Breathe in, breathe out. You can go all the way to the back. Then you do in a meditative posture. Close your eyes, follow your breath, and continue with your breath. Head below your heart increases the intracranial pressure, intraocular pressure, intra-arterial pressure, pressure inside the arteries, but keeping the head down longer and longer, it causes baroreceptor sensitivity, and slowly pressure inside the brain called intracranial pressure comes down, pressure inside the eye called intraocular pressure, which is called a glaucoma. Many a time it says when you have a glaucoma, don't put your head down, don't do anything with the eyes. In fact, we say completely opposite. Slowly put your head down. Remember, no pain, effortless breathing. Annamaya kosha to pranamaya kosha. Eyes is also part of Annamaya Kosha like the body. Any imbalance in the eye also shows up in your breath. As long as your breath is effortless, you won't be able to hurt yourself. Then you will see, you will be able to do a movement of Kapalbhati Pranayama. We don't do pranayama standing up, we do all the pranayama sitting down, but a Kapalbhati Pranayama you can do as a movement and relaxation. So you'll be able to see, I'll be able to spread my leg, I'll be able to put my head down, able to do Kapalbhati Pranayama. Movement, all the movement in the body. Here I am, my head down, all the way down. We do it for a long time, just to show you a sample effect how to do it. You also can do the balancing poses with this Kapalbhati Pranayama. Balance and movement goes together. Put your feet, put your hands in a prayer pose, or you can put a prayer pose to the back. When you do a prayer pose to the back, it gives a little more effort in the balance. So put it below the knee, put it above the knee. If you do a tree pose, percussion, and a percussion, you can do a hands in the back, looks a little different. To the opposite side, below your knee, above your knee. Try not to put in the knee. Knee is a very stabilizer. You do a lot of pranayama with the movement, and you will see that how you can incorporate in your daily practice. In sitting down, the movements you do first, say for the joints. For the joints, you will be doing say shoulder joint, ball and socket joint with your breathing. Breathe in, breathe out first. Deep breath in, movement, rotate your shoulder. Breathe in, breathe out. Breathe in to the opposite side, breathe out. The hands at the top. Hold your hand at the top. Breathe out, breathe in. Move it all the way down behind your neck down. With your breathing, breathe in, breathe out. Breathe in, breathe out. You do the neck movement. Remember, when you do all this movement, you will see your whole body is moving. Movement as a medicine. You move your neck, it's called your Brahma Mudra, 4 posture, front and back, side to side, looking all the way to the back and turning your head from left to the back to the right, right to the left to the back, right to the back to the left. You can do it with your prayer pose to the back, Paschim Namaskar, hands in the back, hands together. Then you also incorporate your bumblebee breathing, Brahmari Pranayama, during your exhalation. That keeps your vibration, quiets down your mind, and also puts a movement of your body and mind. Breathe out first. Deep breath in. Pranayama practice is a movement. Incorporating pranayama with your asana practice is the part of yoga therapy. Asana and pranayama prepares your body and mind for meditation. Simply is doing, say, Bastrika, active inhalation, active exhalation. I was inhaling and exhaling. Balancing, what we will do, we'll do an inhalation and exhalation. Like here, breathe in, Keeps your main part of your body open, the nose, where you're breathing. You do that. Janati in the morning. Same way, show you the Bastrika. I'm giving some example, but the practice wise, you have seen, I do recommend the practice, effortless ease. There should be no effort in your breathing. It will be like a normal breathing. Next, breathing with Bastrika, like continue as long as you can. I'm giving you some example so you can incorporate a daily practice. Or you can do a little faster, like the way we do, as like a yogi doing Bastrika Pranayama. Or you can do hand raising, very slow, medium and fast. Let me show it to you, 10 slow, 10 medium, 10 fast. Generally we do 20 slow, 20 medium, 20 fast. That's one cycle, and you continue the cycles. Medium speed. Rapid speed. These are movement, respiratory movement. Also in the mind, when the mind is moving, focusing, moving, that's also movement as a medicine. We'll finish today, you'll see, we'll finish today with a meditative alternate nostril breathing, with the focusing on your breath. That is also movement. And as I always said, flexibility of the mind is a movement. You go to the same restaurant or the same food every single time, that's a rigidity. That is not a movement. Find a different restaurant. Try different food. Used to walking, if you like walking on the street, go to a beach and see how it feels like. Or if you like walking on the beach, come in and walk on the street of the city. Kapalbhati Pranayama is a movement. You have the belly button, push it inside and moving. You can see the example. Abdominal lock, Uddiyana Bandha is a movement. Adhi Sarkar, moving the abdominal wall and massaging all the abdominal organs is a movement. Any organ, if you can massage, organs start functioning well. Any organ, if you massage, underlying disease is going to go away. Abdominal lock. Breathe out first. You can see better. Breathe out first. Deep breath in. Remember, all these practices has to be effortless. The moment you have an effort in breathing, it has a opposing effect. Agni Sar Kriya. Breathe out first. Deep breath in. The whole abdominal wall massages all the intra-abdominal organs. Agni Sar Kriya. Ujjayi Pranayama, also a movement. Slowly and slowly it constricts the larynx. Then you incorporate the chin lock, which is also a movement, and you have a left nostril breathing, Chandravedi Pranayama. Initially, Ujjayi Pranayama or victorious Pranayama will sound like an ocean breath. Slowly you tighten up more and more the larynx. You will hear a distinct sound. You will see you get so relaxed, you automatically get, say, your abdominal lock like this. as if movement of the mind is the focus, but movement of the mind is opposite of generating thought process. When you enter into the state of meditation, you do not have a thoughtless situation, you still have the thought process. We're generating thoughts. We're generating thousands and thousands of thoughts daily, hourly, in minutes, in seconds. Majority of the thoughts are in the past. Some in the future, but very few in the present. Even in the present, the most of the thoughts are repeat thought process. It's called chattering of your mind. Slowly and slowly, in a movement of mind, you enter in between the thought process. Increase the gap slowly. You still have those thought process, but there is no ripple. It's like a fall, like a Niagara Fall slowly becomes a river. River comes down to the branches in a very small areas, and the water became almost like a standstill, like a pond. You can see the ripples. Let's finish our practice with this called a breath focused meditation and alternate nostril breathing without closing the nostril. Touch your index finger and a thumb. This is your Tanu Mudra, Oregano Mudra. Close your eyes. Visualize. Visualize, breathe out first through your nose. Visualize your breath outside the nose. Visualize you're bringing the breath through your nose. Nose is like a filter. It's cleansing up all the air you are breathing. Nose is like your personal air conditioner. Outside air is warm, it's going to cool it down. Outside air is cold, it's going to warm it up. Air goes on side of the nostril what that is called turbinates. Turbinates generates a vortex. The vortex goes over the sinuses. The mucosa of the sinuses releases a substance called nitric oxide. Nitric oxide is a potent vasodilator. Opens up the blood vessel and it maintains the endothelial health of the endothelium, inner lining of the blood vessels, also the coronary arteries. Nitric oxide is also a mediator of parasympathetic tone. Other mediators are cyclic GMP, acetylcholine. Air is going behind your throat, in the trachea, upper part of the lung, middle part of the lung, lower part of the lung, almost to the level of your belly button. Hold the breath there. It's called Cable Kumbhak. Then visualize the breath is coming out from the lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, coming through your nostril. Air is coming out as in exhalation, out breath. Out breath removes all the toxins from our body. Analyzing the out breath, we can diagnose about 450 different diseases. Breath is a carrier of prana. Prana, the subtle energy, keeps us awake, alert, and alive. Breath is not the prana. Metaphorically, prana is like electricity, and breath is like the cable. Visualize breath is carrying the prana through your breath, and from the yogic tradition, your whole body does the breathing. Your liver does breathing, kidney does breathing, your skin does breathing. Visualize breath is taking the prana to the organ of healing. For myself, I have a heart problem. I visualize prana is coming to my heart. It is causing the healing of my heart. Also, people with the back pain, visualize prana is coming through your back. People with diabetes, prana is going through your pancreas, called pranic healing. Pranic healing is done. You enter into a meditative alternate nostril breathing. You are in silence. Here I am doing a little talking just to guide you. Silently visualize your breath is at the left nostril. Breath is coming out through the left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. Close your eyes, silently do the breathing, alternate nostril breathing without closing your nostril. Slowly bring your hands in front of your heart chakra, Anahata chakra. Touch your little finger and thumb, separate other fingers, called Padma Mudra, Lotus Mudra. Connects your body, mind and spirit. Slowly bring it close to your heart. Heart is the site of your soul. Movement of every part of your body is medicine. Movement is life. Flexibility is life. Rigidity is death. Flexibility of spine is a health. Meru in Sanskrit, spine is called Merudand. Meru is the tip of the mountain. Dand is a stick which is carrying our top of your mountain, the head. Always incorporate movement of your joints. Pain in the joints starts from the tightness. Relaxation of the joints, pain will go away. Daily yoga practice is a wonderful practice for seniors, for get rid of chronic pain and to bring the balance back. Put your hands slowly in front of your heart chakra and finish with the palming and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the heat in your hands, if you're wearing glasses, remove your glasses, take the hands like a cup, put it over your eyes, let the eyes take all the heat from your hand. Then slowly massage your forehead, massage your eyes, massage your face. All the muscles in the face are attached to your skin. So relaxation of the muscles removes all the frowning, all the lines. It ignites your Agni, the digestive fire, the fire within you. It creates a teja. It looks like you are glowing. Take your hands behind your ear. Massage the ear, in the earlobe, in the back, in the front, and also inside the ear. Is a branch called auricular branch of vagus nerve. Vagus stimulation is a relaxation response. Hand comes, massages both sides of the neck. These are called massaging carotid sinuses. Massaging carotid sinuses causes wetting down of your cardiovascular system and nervous system, and it's a parasympathetic activation, relaxation response. Hand goes to the back, massages in the back where there is the insertion of two cranial muscles, trapezius and sternocleidomastoid muscle. It's a wonderful relaxation. We practice it every single day. We practice the movement. We practice the movement, and the movement creates the balance. And the balance is your health. Balance of your body, mind, spirit is the health, and the practice of yoga starts with called Rogir Chikitsha, treatment of a disease, and then Shastro Rokha, maintenance of your health. This is the maintenance of the health which keeping us as young as possible and as late of our life. Practice of yoga causes compression of morbidity. All the morbidity what we have, lifestyle related disorder, high blood sugar, high blood pressure, coronary artery disease, atherosclerotic disease, these are all aging process, like gray hair, enlarged prostate, you're going to have it. When you get it early time in your life, that's a disease. In later part of the life, it is your comorbid condition, and we call compression of morbidity. Thank you for joining the class. We'll be coming every Saturday from here, unless I'm out of town, unless we have some other assignment. I think next Saturday we have a socio-cultural program and religious program called Saraswati Puja. That should be, yes, February 5th. So on February 5th, there will be no class. So I'll come back in 2 weeks.